So your dancers have taken the summer off, and now they come back to class, and they're confused inside their own bodies. Overuse injuries can happen easily during a growth sport. The bones can be growing faster than the muscles and tendons, which means those tissues can be easily stretched and strained more likely. Some dancers even develop knee pain such as Osgood-Schlatter's disease, or heel pain such as Sever's disease. Both of these conditions can result from rapid growth or overuse. Dancers may experience problems with coordination and agility during these times with growth also. Symptoms of Osgood-Schlatter disease will usually go away when the child stops growing. This can be about 6 to 24 months, depending on the athlete. Children may need to rest or do activities that don't cause knee pain. This can be problematic in dance when you're setting choreography and it's a team sport. Treatment that works for some dancers may not work for others. Dancers can try resting the joint, limiting the time they spend doing activities that aggravate the condition, avoid kneeling, jumping, and running, ice the affected area. This can help with pain and swelling. Stretch the leg muscles, protect the knee, try a strap or supportive device, cross-train in other sports that are non-weight bearing such as swimming, or modify their dance training schedule. Osgood-Schlatter's disease is also known as apophysis of the tibial tubercle. It's inflammation of the patellar ligament at the tibial tuberosity. How do we know when our dancer might have this? It's characterized by a painful bump just below the knee that is worse when the dancer is being active, particularly when jumping, and it'll feel better with rest. Sever's disease, also known as calcaneal epiphysitis, is an inflammation of the growth plate of the heel. This is common also in growing dancers. The condition presents itself as heel pain and is caused by the repetitive stress to the heel. It is particularly common in dancers and active children. The reason why dance can aggravate this is because of the jumping. If you think your dancer might be suffering from Sever's, it's important to encourage supportive shoes and inserts that reduce the stress on the heel bone. Stretching the calves, the gastrocnemius and the soleus, is very important. It's also important to consider strengthening. The disease is self-recovering, which means that it will essentially go away once the bone is through the growing phase. It's not expected to create any long-term complications. Hopefully it subsides for your dancer in a short amount of time. The disease is more common in boys than girls, and the average onset of symptoms is between 9 and 11 years. The biggest thing that we need to consider with our dancers who may be going through growing pains, changes in their body shape, changes to their hormone, puberty, and social circles, is to understand that these dancers are going through a period of change. During these times, sometimes their dancing might seem a little bit off. They might feel a lack of coordination and agility. It's our job as educators to support the dancers through these difficult times. Go back to the basics. Focus on the core fundamentals of your technique, placement and line. Allow some error for changes in balance, and continue to focus on basic technique. This will allow the dancers to have success and gain more confidence as they go through these changes.